Well, the coronavirus pandemic has not only taken a toll on our physical and financial well-beings, but it's had a huge impact on our mental health. And in minority communities where COVID-19 has hit the hardest, there was a long-standing taboo around mental illness concerns. So in light of this, actor Taraji P. Henson recently launched free online therapy services targeted to African Americans. And here is what she had to say on the issue to ABC's Lindsay Davis.
Oh, because I'm blessed, my father always told me to be a blessing. And so I started this foundation because of the stigma around mental health in the African American community. And I think now is the time, because all we have right now is time on our hands, is to try it if you have reservations, because you're in the comforts of your own home. You don't have to worry about feeling embarrassed or being looked down upon because you're stepping into an office where there are therapists there. So I think it's a good time for people to try it. It has been overwhelming, the response. We have hundreds of new therapists that have signed up. Once this is over, is said and done, all of us will be traumatized.
But in African-American culture, there seems to be this tradition of kind of keeping your problems to yourself, fighting through it, being tough, not putting your business out on Front Street. Yeah. So what do you think it is about the Black experience in America that makes this idea of therapy such a unique challenge?
I think it's about finding the right therapist, someone who understands your background, where you come from. One thing I would like to see more men apply. Out of all the applicants right now, we have 71% are women and only 6% men. And I'm just pushing for more men to just please allow yourselves to be vulnerable.
Our thanks to Lindsay and Taraji. And here to give us more insight on the mental health stigma in African American communities is Associate Professor of Psychiatry at Duke University and author of Black Man in a White Coat, Dr. Damon Tweedy. Dr. Damon, thanks for being with us. You just heard what Taraji P. Henson said about the Black experience, but she did reference specifically Black men. Why do you think that that's been such a tough area for that group to seek therapy?
Well, I think it's a couple things. If you think about sort of the history of African Americans in the United States, the narrative is often around overcoming adversity and oppression through faith and family and community. And if you contrast that with the mental health narrative, historically, what we think about is something that's largely white and is more kind of sterile, focusing on individuals, not groups, and also catering to a more sort of wealthy sort of clientele. So you can see that there is this kind of a clash right there. When you think about the idea of a Black person sort of going to a stranger and sharing their, often who's white, and sharing their experiences, you can sort of see how that would pose a challenge for sure. And then when you talk about the aspect of being a male, you have to sort of superimpose the idea that there's a broader sort of idea about masculinity and being tough and manning up and not being weak. And so that's often accentuated among African Americans. And so you see that there's this sort of combination of both the racial side, and then there's just the sort of being the male side. And so Black men sort of get that kind of perfect storm, if you will, that kind of can scare them from seeking mental health treatment.
Yeah, and it's especially unfortunate during these times because we know Black men are among those hit the hardest from coronavirus and the economic repercussions of this pandemic. So talk about why their mental health is more important than ever before.
Well, yeah, I mean, I think the first thing is to think about is that when we say physical health and mental health, we often just keep those as two separate things. And that's one of the problems, I think, that we continue to deal with both in medicine but also more broadly in society. Physical health certainly impacts mental health and vice versa. So if your mental health is adversely affected, that in turn will also impact your physical health. And so they're very intertwined. And as you said, Black people are often bearing the brunt of this virus in terms of a lot of early data is just suggesting this. I even recently read something in the Washington Post about my own hometown in Prince George's County, Maryland, talking about the disparities there. So it's also a very personal thing to me as well. But the two things are certainly very intertwined, physical health and mental health. So it's really important to attend to both in this time.
Yeah, and self-awareness isn't something that most of us possess at most times. So how do you know if your mental health is in jeopardy? What are some signs you should look out for?
Yeah, I mean, there are many things. So, I mean, significant changes in sleep patterns, eating patterns, being more irritable or withdrawn from people that you are close to. I mean, those are some of the more early red flags, and there are many other things as well that we can think about. As you mentioned, we're often not self-aware, so sometimes it involves listening to those who are close to us. Like, many people that I see, their wife or their sister, husband, whoever will say, you know what, you're not yourself, and you should come talk to someone about that. So I think that's also a big piece, being open to listening to those around you.
And know that you're not alone in this. Dr. Damon Tweedy, thank you so much for being with us today. Really important conversation.
Yeah, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.